such a deep wound, Tom knows Rafa could have catastrophic internal bleeding. He needs to get him to hospital fast for emergency surgery. The danger is that moving him may put too much strain on him and send him into cardiac arrest. The wound has gone so deep, his bowel is now protruding out of his abdomen. Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers.
Okay, all right, bud. All right, bud.
Ambulance service, is the patient breathing?
Yes, yes, but the person's on the floor.
Away.
Yes, but the person has cut the belly.
Have they fallen? They've put themselves with a chainsaw. Are they able to see to me?
No. Oh my God,
okay.
Everything's out.
His intestines?
Yeah.
Has he lost enough blood to fill 2 mugs?
Yes, a lot. Please, just come.
We're coming on blue lights and sirens, so we're going to be there as quickly as we can.
It looks like a 43-year-old male who sustained an abdominal injury from a chainsaw, and his intestines are out on the floor.
An ambulance is already on scene, but the man's injuries are so severe that they've requested critical care backup. Tom has been dispatched.
It's easy to paint a picture, but you really don't know until you get there.
11 minutes after receiving the call, Tom arrives at the address. His body cam records every detail of the horrific scene.
Hi, you're right. Hello, sir. My name's Tom from the air ambulance. What's your name?
The injured man, 43-year-old forklift driver Rafa, is being given oxygen by the ambulance crew to try and keep him conscious as his body reacts to the shock of the 5-inch wound to his lower abdomen.
Right, so with this, if you just want to cover that with that. Perfect.
I'm just taking a photo of it.
No, that's fine.
Just in case you want.
Right then.
It looks like it's adipose tissue more than anything, doesn't it?
The blade has sliced down through skin and flesh, exposing his intestines.
Oh.
Tom needs to try and keep the wound clean, prevent his intestines coming out, and stop the bleeding.
Hopefully, if we can just hold it around it will stick to it a little bit. And then, if I can get you guys to put some tape around that, is that all right?
I'm just going to stick the dressing down, Raphael, OK, just to keep it clean.
OK, so this gentleman, age, I believe you already know. He's a GCS of 15 at the moment with isolated abdominal injury with partly eviscerated bowel.
With such a deep wound, Tom knows Rafa could have catastrophic internal bleeding. He needs to get him to hospital fast for emergency surgery.
I think my initial plan would be to get some IV access, wound management, and then convey him to the QE.
The danger is that moving him may put too much strain on him and send him into cardiac arrest.
How are you feeling?
All right.
Sam, can you get some IV access? Is that
Operation, yeah?
Yes, he will need to. All right, we're going to cut this off.
It isn't safe to move Rafa until Tom knows the full extent of his injuries.
Right, just put him forward. I just want to check his back while we're here.
Yeah.
It's very sweaty, isn't it? OK, so no other injuries. Was this done on a chainsaw?
Yes.
Can you find out exactly what's happened?
The gentleman there speaks English.
How are you feeling?
He went on a ladder. He was doing something around this thing.
Yeah.
And, yeah.
It turns out Rafa was fixing the guttering with an electric saw.
This one?
Yeah.
When the ladder slipped, the saw ripped through his abdomen.
Yeah, 6'2", just an update. So heart rate's around 50 at the moment.
Rafa's blood pressure is low, which could be a sign that the blade has damaged some large blood vessels internally or even perforated the bowel.
He's quite clammy and sweaty at the moment. I see no immediate signs of him hemorrhaging, however, I don't know how deep it is.
They have to get him to hospital.
I'm going to get him in the back of the ambulance and convey QE. I'll put some details for as we go. OK then, Rafa, we're going to put our chair here. We're going to get you to move you and take you into the back of the ambulance, OK? My only concern is he's a bit hypotensive, so he might go a bit funny if we stand up. So we're trying, obviously, avoid as little movement as possible. Hold on to my hand. OK. Do you feel like you can walk? No. OK, that's great. Are you sure? OK.
Despite Rafa's horrific injuries, Tom has no choice but to move him onto the ambulance.
Yeah.
Keeping the pressure on the wound to stop his intestines spilling out.
I'm just a bit worried he's a bit hypotensive, so we'll just take our time. Well done. Up you come. So, at the moment, this gentleman's got a circular saw accident to his stomach, part of his bowel, and a lot of his stomach is out at the moment, so we've dressed it. I'm going to give him some drugs to stop him bleeding and pain relief and take him to the major trauma hospital in Birmingham.
Just going to give you some pain relief, some paracetamol, okay, to help with your pain, Rafa.
How are you feeling? Yeah?
They head to the major trauma centre at the Queen Elizabeth Hospital, where Rafa will need immediate surgery to repair the wound and stop any internal bleeding.
Rafa, are you all right holding that?
On the journey, Tom needs to keep his patient under close observation. There's a real danger his low blood pressure could suddenly drop, putting him into cardiac arrest.
Rafa, how are you feeling? All right? Good. Well done. You're doing a great job. We're nearly there.
Arriving at hospital 23 minutes later, Tom can hand over his critically injured but now stable patient to the waiting specialists.
Thank you.
Through to the ambulance, is the patient conscious and breathing?
Somebody stabbed him on the neck.
Do you know if he's breathing?
He's breathing at the moment, yes. He needs the ambulance quick as possible. A lot of blood coming out.
Is the blood spurting out?
Yeah.
It is, my love, okay.
Oh, my God.
Just keep pressing on his neck, my love. We're coming as quick as we can.
Oh, God. I've never seen anything like this. It's getting worse.
Just keep the pressure on that bleed, love. You're doing all you can.
Hi guys. I'm Adam. I'm the doctor on Mayhem. Who's behind you? You okay? Okay. Don't fight. Don't fight.
Adam immediately takes control of the scene, locating and assessing the size and severity of the neck wound.
See? Shut up. Okay.
Can you hear us? Okay.
Right. So quite a lot.
What's wrong with your breathing? Can we get the trolley out? I feel like this.
Okay, guys.
We'll have the trolley out.
He's bleeding heavily and struggling to breathe.
Okay. Big. Adam, can you see down there?
The victim is just 16 years old.
Okay. So we've got one behind the ear.
Yeah.
Is there anything at the front of the neck?
Okay, put a direct on there then.
He's already lost about a litre of blood. The human body contains 5. Adam knows he can't afford to lose much more before he passes out and goes into cardiac arrest.
Right, let's have a look.
What's gonna happen now? Listen, what's gonna happen? Don't worry about them. Look at me. What's gonna happen? I'm gonna get you onto an ambulance, okay? Let me just see if there's any blood in your mouth. Open your mouth wide. Good lad.
Nothing.
Pressure from his wound is causing the boy to panic and restricting his breathing.
Just calm your breathing. You're doing absolutely fine. I know it might feel hard where you've been injured. Okay, it's away from your voice box. I know it's scary, okay, but you're doing fine. I'm pushing on the side of your neck.
They need to get him to hospital for emergency surgery to repair the blood vessels in his neck, but moving him risks tearing the wound and sudden catastrophic blood loss.
Not time.
Okay.
Okay. Right. Listen, have you got phlegm at the back? Just spit it out, mate.
Just spit it on the floor. Go on.
Adam needs to keep the boy calm while maintaining a constant life-saving pressure on his neck to stop the bleeding.
Do you feel able to stand, mate?
Yeah.
Okay. Right.
Good lad. Yeah, go on.
I'm not going to let go because I need to put that pressure on. Okay. Hold on, guys. Hold on. I need to keep the pressure on.
Can you get around, mate, to you? So, bump there, that's it. Lay down on the bed.
Okay.
Once on the stretcher, it's now a race against time to get him to hospital.
Fine, mate, you okay? Can we have our bag on the back? Yeah. My hands are going to be a bit tied up just to keep that pressure on. So let's get some straps on. How are you doing? All right, well done. Okay. I need to keep to the QE. Yeah, I need to keep my hands on to stop the bleeding, okay? Because you have bled a reasonable amount. Any medical history I need to know about? Asthmatic? Sickle cell? No? Are you allergic to anything? Right,
Leave a little bit of room for me. That's it. Well done. Good, so a bit brighter in here.
On the ambulance, Adam and Rob can now fully assess the damage the knife has done.
Hi, mate. You're right.
He's bled a fair bit of volume and he's still bleeding past my hand, so I need to get a grip on where that's coming from. The Tacky 130, active from the back. It's not anywhere major vascular, but it is actively bleeding. Can I have that Celox, because I can see where that's coming from now?
Hold on, Adam.
Using a gauze coated with a blood-clotting agent, Adam manages to stabilise the wound as much as possible to prepare for the journey.
Okay, Rob, do you want to carry on looking at access for me?
Yeah. Give us that arm, mate.
The boy is in such a critical condition, they both need to travel with him, continuing emergency care throughout the 6-mile journey. Arriving at hospital 11 minutes later, Adam delivers his still critically ill patient to the waiting emergency staff.
That's one of the things we are there for. We will just bring some advanced decision-making in terms of which hospital we're going to. We won't go to the nearest hospital. We will travel a little bit further with an unstable patient to get them to the right major trauma centre.
Ambulance service, the patient breathing.
I don't know, there's been a fight. He's dead cold by the looks of it. Somebody's having a right panic. You need to get somebody in straight away. Can you hear it going on?
Yeah, okay, so male adult.
Male adult by the looks of it, yeah.
And you said that he seems unconscious.
He's dead cold, love.
Have you got any idea what's happened at all?
You look like it at the fight. It all happened really quick, and then all you heard was this crack. And I'm reckoning his head on the tile floor. He's bleeding, or he's being sick. Whatever it is, it's not looking good. Can you hurry up with the ambulance, please? They're doing CPR on it.
They're doing CPR, okay. We are coming as quick as we can, blue light.
An ambulance has been dispatched, but the man's injuries are so severe he may be in cardiac arrest and in need of enhanced critical care from Ravi and Richard.
We are going to central Birmingham to reports of an unconscious patient following an assault.
500 yards.
Hi, thanks. Just a quick update from the scene. There's a few crews in attendance. The patient you're going to has a GCS of 3. He was hit over the head with something. He has his pupils, trismus. They report the scene as being very chaotic. They're scooping the patient and loading him onto the back of the ambulance. They're going to try and get bilateral IV access ready for you.
Yeah, that's received. If they are having airway issues, I would suggest that they go to nearest whilst we make our way.
Yes, absolutely. They were still on scene when I spoke. I think, from what I heard, you are going to make scene before they're ready to leave. Received.
Yeah, many thanks.
The patient is in a life-threatening condition. He's deeply unconscious, and the ambulance crew already on site are struggling to get oxygen into him.
What they're reporting is trismus. Essentially, the jaw is locked, which means that the patient may not be able to get enough oxygen to the brain and to other organs. So if we're struggling with that, then we may have to act pretty swiftly. As you're probably aware, the brain can only survive so long without oxygen before you have irreversible damage.
He's now on an ambulance. The crew brief Ravi.
What's going on?
This is Julian. He's assaulted in the head.
Yeah.
I'll step up to GCS 3.
Yeah.
32-year-old lorry driver Julian was on a night out when he tried to intervene in a fight. He was punched and fell to the floor. He's now fighting for his life.
Whether CPR was started or not.
Yeah.
There's a lot of commotion.
Yeah.
His right ear, he's got zero levels of congealed blood. Pupils, left side sluggish in 3s, right side was reactive in 3s.
Julian is completely unresponsive and bleeding from his ear. all the indications are he has suffered a traumatic brain injury.
He's trismus. We couldn't get an APA in, so we popped an MPA in on the left-hand side. Stats were 92 on air, they're now 100% on 15 litres. Got bilateral access. He's been blood pressure stable throughout, and we've given him 1 gram TXA.
Brilliant.
Julian's jaw has locked, so the paramedics have inserted a tube through his nose to get vital oxygen into him and keep his heart and other organs functioning.
Looks like gentleman's been assaulted and it seems deeply unconscious at the moment. So Ravi's just going to assess him, but we may just travel as we are because we're not that far from the hospital and reassess on the way.
You might as well tell him to get ready.
Yeah.
Julian needs all the skills and resources of a major trauma hospital. As the Queen Elizabeth is just 10 minutes away, Ravi decides this is the best option.
Hi, it's Ravi. So can you just put a quick alert to the QE to say that we're going to be there in a couple of minutes with a GCS3 head injury, observation is stable, and have anaesthetics on standby. So we're not going to RSI here, but you'll probably need us. Okay, cool. All right, so that's bye.
Having updated the trauma desk, Ravi monitors Julian closely throughout the journey, while Richard follows the ambulance, ready to help should his condition deteriorate further. At the hospital, Julian is taken straight into the emergency department for ongoing trauma care.
It's difficult with these conditions and these incidences to determine what the outcome's going to be. Because I work in the intensive care setting, this is something I see quite regularly, and there are people that come in very unconscious that wake up and walk out of hospital 12 hours later. And on the other end of the spectrum, you've got somebody that's severely disabled that needs care for the rest of their life. Until the hospital have done the scans, they've given him some time to recover, you know, we won't really know what his outcome's going to be.
Ambulance services, the patient breathing?
Yeah, he's had his hand in a steel saw.
A steel saw?
Yeah, it's gone straight through. Yeah, I don't want to describe it too much.
How far through his hand has the saw gone?
Dan, you need to move your hand, please, because I need to describe it too much. I need to put your hand over your face. Hold on. Oh, very bad.
We'll get someone to him as soon as we can. Just keep the pressure on the wound, directly on the wound.
An accident with a power tool can inflict life-altering injuries. An ambulance has been called, but they've requested specialist trauma backup, and critical care paramedic Tom Waters is now en route.
Looks like I'm going to be first on scene, and it's someone, they just said, who's cut through his hand with an angle grinder. DIY gone wrong. The benefit that I think my team and myself can go to is we can hopefully make that assessment to really identify what hospital is best for that patient.
10 minutes later, Tom is on scene. The local ambulance crew are already there.
Hello. Hi, you're right. So what's happened?
He was cutting the door frame there and went straight through his hand.
30-year-old bricklayer Daniel was cutting the timber on a workbench using an angle grinder with a 4.5-inch circular blade when he lost control and it sliced through his right hand. His wife Stacey found him and has been trying to stop the bleeding.
Okay, and how bad is it before we have a look at it? Is it pretty bad? Okay.
Yeah. He hasn't seen it.
Okay, what's your name, sir?
Daniel.
Daniel. Do you live here, do you? Is this right? Okay.
Yeah.
The paramedics have been on scene for 5 minutes. Daniel is in a severe state of shock and close to passing out. They've got him to raise his arm above his heart to try and stop the bleeding.
It's fine. Have you got your trauma pack with you tomorrow?
No, I can go.
Yeah, I think maybe if you're saying it's quite bad, we'll get our bandages just in case. If you hurt yourself anywhere else?
No.
No, so it's just your hand?
Yeah.
Okay. Do you mind if I...
Yeah.
This impressive towel you got on here.
It's the second one.
Okay. Okay, so what we'll do, before we open it up, we'll get our bandages just in case.
Daniel's in excruciating pain and can't bear to look at the damage he's done.
Let's have a... All right. Are you all right to come round here and cut his sleeve off? Yeah. I've got some scissors on me, if you want. Yeah. So quick. Okay. I know. Sorry, buddy. We'll give you some pain relief, but what I want to do is have a real quick look at it first.
Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers. Both require immediate surgery.
Okay, all right, bud. You feel me touching you here? Okay.
Daniel has a 3-inch wound, 1.5 inches deep between his thumb and forefinger. Once the towel is removed, it starts bleeding freely again.
Wiggle that thumb for me. Can't. Okay, all right. What we're going to do, buddy, is we're going to clean it up. It's in the corner bit of your thumb. That make you obviously know where it is.
Lucky for Daniel, the blade stopped short of the bone.
Straighten that arm out for me. I'm sorry. Well done. I just want to straighten this hand for me.
Daniel is fortunate. All his fingers are still there, and there's no obvious nerve damage. The wound will now be cleaned with saline solution and dressed to immobilize the fingers and help stop the bleeding.
It's just obviously in the crease of his thumb. He's got good circulation here. Yeah, and he can feel me touching his hands. Yeah. And it's, yeah, so I think it's just more soft tissue. Yeah. We're going to cover it. Yep. And then I think we'll...
If we just take a picture? So
yeah, that's fine.
One of the paramedics takes photographs of the wound to show to the hospital doctors in A&E so they can assess whether he needs immediate surgery.
Yeah, nice and still.
All right. Keep still for us, buddy. As soon as you've done this, we'll get you some pain relief.
Last year, almost 5,000 people were admitted to hospital following accidents with power tools.
We're going to bandage that up. It's going to be a little bit painful for a little while.
I'm sorry, mate. When you're working next, don't say Monday.
Yeah. It won't be.
I think it probably feels and looks worse than what it is.
Yeah.
I think it needs to be cleaned, it needs to be x-rayed. Yeah. And it needs to be stitched back together.
Cheers for that. I don't know how you lot could look at it, to be fair.
It's all right, mate. There you go. Just take your time, nice and slow. We're in no rush. Feel all right? Let me just walk behind you.
With Daniel now recovered enough to walk out to the ambulance, Tom is happy to leave him in the care of the local crew for the journey to hospital.
He'll go to the local A&E where he'll get it cleaned. He most likely will have some form of antibiotics and an x-ray, and then it'll be decided onto there if he needs specialist care to treat that part of his hand. It's very much in the forefront of our minds that we want him to get the best care for his hand. So he's a young chap, he's a labourer, we obviously need to get him back to work as soon as possible. It could have been a lot worse. It's still going to be a really painful injury, but hopefully I'll have a really quick recovery.
Ambulance service, is the patient breathing?
Yes.
Is the patient conscious?
Yes.
Ma'am, what's the problem?
He's really struggling to breathe. He's just literally come on really fast. He's absolutely blue here.
Okay.
All right, okay.
Is he still breathing?
Only just. He's gone all stiff on me now.
Is he taking regular breaths at the moment?
No. Dropping at the mouth.
Is he having a seizure?
I think he's having a seizure.
Okay. Let him go with it.
Come on, Dad. Okay, they're coming now, darling. Okay, I've got no breathing.
Okay, roll him onto his back for me. I'm going to tell you how to give life support. They are pulling up outside, but you need to start this, okay? One hand flat in the centre of his chest, put your other hand on top, lock your fingers together. Keep your arms straight, push down, hard and fast, 2 times a second.
Yes.
I want you to do that until the crew are right with you, okay?
I know.
You're doing a really good job. You're doing really, really well.
Okay, they're here.
An out-of-hospital cardiac arrest is always a code-red emergency. Without swift action, the man, 79-year-old David, could die in minutes. The local ambulance crew has called for immediate critical care backup.
This is a crew request for assistance for an elderly man. I think the call initially came through as fitting, but is, I believe, now cardiac arrest. And I think they're struggling with some airway management options, which is one of the skills and health skills that we carry.
Thanks to his daughter's prompt action and the crew's response, David's heart is beating again, but without enough oxygen, his life is hanging by a thread. Jack carries drugs and resuscitation equipment that could save his life, but he's still 5 minutes away from the address and may not get there in time.
Downtime has been I think fairly considerable now. I think call time was 20 past 2 and we're now approaching 2:40, so we've had 20 minutes of potential cardiac arrest, so it might be that by the time I get there, actually we're past the point of making a meaningful difference for this gentleman and we go no further. 62. Hello mate, how you doing?
Jack arrives at the address and is immediately briefed by the paramedic team so he can lead the treatment.
We have 74-year-old David.
Hello David.
79-year-old.
Yeah.
Collapsed, daughter said his breathing went funny.
Yeah.
She started CPR. Initially querying if there was a carotid when we got here.
Yeah.
There was a gonal breathing.
Yeah.
He arrested at 14:19.
Okay.
And we got a ROSC at 14:35.
Nice one.
Daughter Caroline, who was with him when he collapsed, has been joined by other concerned family members.
Awesome job.
The paramedics have inserted a tube into David's throat and he is now breathing with the help of a ventilator.
I'm just going to get some midazolam and then at that point we'll put him onto my ventilator because it's just a bit better for him, if that's okay.
Jack needs to get David to hospital for urgent tests to find out the cause of his cardiac arrest.
All right, Dad. Nearly done.
But for now, he's focused on just keeping him alive.
David's doing really, really well.
So he's had a cardiac arrest. He's had a cardiac arrest that's been prolonged for quite a period of time. Because of that, his brain's been starved of oxygen, even with good CPR. So it's likely that if he starts to try and come around too much, he's going to be very agitated and quite difficult to look after.
As a highly trained paramedic, Jack is authorised to use specialised drugs normally only used by doctors in intensive care in hospital.
So what I'm going to try and do, I'm going to give him some sedation and potentially paralysis as well, just so that we can look after all of his breathing, all of his awareness.
With David barely conscious, Jack must decide whether to put him into an induced coma to protect the vital supply of oxygen to his brain and organs.
OK, so he's had 3 milligrams of midazolam. He's had that now at 14:48.
If he has another cardiac arrest while he is under full sedation, it will be much more difficult to resuscitate him and he may die.
Yeah, so eyes are open, but he's not really responding to you. He's localising, so that's a 5. Yeah. Ben, can I have a conference call, please, with senior cover to discuss some rock?
Rocuronium bromide is a fast-acting muscle relaxant normally used in operating theatres before major surgery.
Hi, Neil, you OK? Good. Thanks, mate. So I've got a 79-year-old gentleman who's had a witnessed cardiac arrest at home.
Jack wants to consult with the senior doctor on call before he decides whether to go ahead and use it.
Giving him a small amount of midaz, so 3 milligrams, just to try and flatten him out a little bit. So the call is to discuss potentially to add rock over the top of that to facilitate kind of a safe extrication and get him off to hospital. Let's try the SIMV first, no problem. Yep, sounds good to me. Thank you so much, Neil. Have a good day. Take care. Bye-bye.
For now, Jack will keep David on the ventilator at his current level of sedation.
Have you got a full cylinder there, guys, or a nearly full cylinder?
We've got a spare one on the other side.
Perfect. So if we pop that on the where yours is, yeah. So what this will do is it will support the breaths he makes, and it will add a couple in over the top. I'm happy if you want to just break the scoop and we'll start sliding it underneath and get him packaged, but we'll obviously just keep it nice and steady, keep a close eye on him. Looks like he's fighting a little bit, isn't he?
It's common for someone who has suffered a cardiac arrest and been resuscitated to re-arrest again on the way to hospital.
We'll get him strapped and packaged, we'll do one last check, and if we're happy, we'll extricate him out to the stretcher, get him onto the ambulance, reassess him there. The way he's going, I probably will end up giving him some rock on the back of the vehicle and just making sure we're settled for the transfer, but if you're happy now, we'll get him out. I'll grab the vent and the monitor. OK, just watch out for all this. Is nice slow time. If you keep coming forward, we'll get out behind you. Nice and high there. So just grab make sure I've got the little yellow handbaggy thing with the drugs in it, which should be on the chair, and the red bag. Is that all right? Thank you. All right? Nice and slow.
On board the ambulance, Jack makes his final checks.
That's right, so we've got airway. We've got IGL size 4 on a circuit that's working. He seems to be tolerating it fairly well. I'm not convinced that he's not making very effective rasps. He is breathing for himself, but they're not particularly strong. On that basis, I would feel more comfortable taking over and giving him the rock.
7.8, I think it was.
Having weighed up the risks, Jack decides the safest course is to take over David's breathing entirely.
So once I give him this, obviously he won't make any movement, he won't breathe for himself, but it's really important that we keep an eye out for things like tearing, tachycardias, and a raise in his blood pressure, because those are things that are going to indicate maybe some awareness. Okay, so I'm going to give him the rock now.
Once the neuromuscular agent has taken effect, David is now effectively in intensive care conditions. His body unable even to breathe by itself.
60, thank you. We're about to leave for Heartlands. If you're ready for an atmist. He has now had, in total, 8 milligrams of midazolam, and I've given him the 50 of rock because he was struggling to fully synchronise with the ventilator in the end.
Before they set off to hospital, Jack updates the trauma desk on David's condition.
We will be 8 minutes to Heartlands received.
Yeah, sorry, 8 minutes to Heartlands.
That is affirmative.
Leaving one of the ambulance crew members to drive his vehicle, Jack will not leave David's side until they arrive at hospital.
All right, David.
Well done, David.
We're off to the hospital, sir. So just become a little bit hypertensive again. So we just want to make sure that that's not any awareness. He's not becoming tacky.
En route, Jack and the ambulance paramedics keep David under close observation. The slightest fluctuation in his blood pressure could be a sign that his heart is about to stop beating.
You've got some global ischemia, but that's normal, that's for reperfusion, so I'm happy with that.
Arriving at hospital, Jack can deliver his critically ill patient to the waiting cardiac team in intensive care.
Skills that we provided there were the sedation, the advanced ventilation, the paralysis, the management of that post-ROS patient who's potentially very unstable, although he did quite well, and make sure that he was handed over effectively ready for ITU. So we had an airway in place. He wasn't aware of what's going on, he wasn't distressed, he wasn't in pain, and we were able to effectively put him onto an advanced ventilator and ensure that his physiological needs were taken care of. The plan now, hopefully, will be to head back to base, restock, maybe have a cup of tea, but we've still got a couple of hours left of the shift, so I could end up going to anything in that period of time. We're just hoping for a slightly more sedate last few hours, but we'll see what comes through.
Ambulance services to patient freedom.
We've just been...
Okay, what have they been stabbed with, do you know?
A knife.
Okay, are they bleeding heavily?
Yes.
And how old are they?
They're adults.
Do you know where the stab wounds are?
One's got one in the stomach, one's in the chest, and one's in the stomach. The one's got 2 stab wounds, losing consciousness.
Are you if he's lost about 2 mugfuls of blood?
It's close to.
Okay.
Can you just send an ambulance?
Yeah, it's not delaying any help, sir, okay.
62 Whiskey Romeo.
Is one of the most challenging situations a critical care specialist can face. If an artery has been severed, a patient can bleed to death in minutes.
Been deployed to reports of a double stabbing, 2 patients, one with chest injuries, one with chest and abdominal injuries in a park not too far from the QE, so hopefully it'll be a case of a rapid assessment, major hemorrhage or life threat control, and then a rapid extrication. 60, thank you. ETA approximately 3 to 4 minutes.
The critical care team in the West Midlands deal with more than 30 stabbings every week. Reducing the number of deaths is one of the service's main objectives.
Police en route. So you'll be sent on scene.
Roger, that's all copied.
We are having updates soon that these patients are unconscious. Please today, their ETA was 2 minutes.
Roger, given the severity of their potential condition, I am happy to make scene with a dynamic risk assessment received.
With 2 patients' lives on the line, every second counts.
Updated report from police has come through that they're both unconscious, so potentially this is going to be 2 traumatic cardiac arrests. 60, that's all copied, just pulling up behind 4634 SRMA 559.
On arrival, it's a major incident, with multiple police and ambulance teams already at the address.
Hi, Rob. Yeah. Roger.
2 neighbours have been attacked. Simon, who's outside, was stabbed while trying to defend his friend. 41-year-old Matthew, who has collapsed in the stairwell, has been stabbed twice.
Come on. Breathe. Come on, deep breath out. Come on, you can. Okay.
He is struggling for breath. The stab wounds are close to his lungs, and they are in danger of collapse.
They put chest gel on, I've not looked at wounds.
That's fine. Is he on O2? Hi, mate.
He's on O2 from police, not ours.
The wounds have been sealed, but with internal bleeding and potential organ damage, he's at high risk of going into cardiac arrest.
GCS 15, chest seal applied, oxygen on, and we're just going to get him gone and gone. He's got a good chest wound and a good abdominal wound.
All right, we'll put him straight on 4634
Yep.
because the crew are with him. The second crew, I haven't seen this guy's wound yet, but it's abdominal.
I'll have a quick
so I'm going to get this team to bring
look.
their stretcher up, and we'll get this guy's.
If we just load them both and just get them all gone straight off. I'm just going to grab an apron because I'm half PPE'd.
Once in protective PPE, Jack can make a close assessment of the other victim.
Rob, whilst they're dealing with him, I'll just have another look through this guy.
54-year-old Simon has one small but potentially deadly incision.
All right, can I have a little look, sir?
Oh. You okay, mate? Just you go. You go.
Okay, good.
You're all right.
It's a bit of bowel, but looks little. Looks like there's too much there with lots of vein through it. Potentially out bowel, but.
The stab wound has gone so deep, his bowel is now protruding out of his abdomen.
You okay, mate? Just you go. You go.
Okay,
You're all right.
If his bowel has been cut, he's in grave danger of sepsis, which can lead to organ failure.
So, hello, sir. My name's Jack, okay?
Oh, yeah.
Do you have any pain anywhere else? Have you been hurt anywhere else?
Yes.
Can we get this bag off you? Is that all right? Are you happy? I'm going to get this top off you, mate, okay? Just to check and make sure you've been stabbed anywhere else, all right? Okay, let's have a look in your arms. Nothing in the back. You definitely weren't stabbed anywhere else? No, there's no obviously bleeding, there's nothing into the wounds. Fine. Okay, good.
You all right?
Yes, happy for this gentleman on your stretcher. Is that the plan, Rob?
Let's get him, because as soon as he's moved...
Yeah, let's go.
Suddenly, a fight breaks out amongst the bystanders, threatening not just the care of the patients, but the safety of Jack and the ambulance crew.
So I've got no obs on him other than he's got a good pulse. He's looking a bit pale, as you can see. Single isolated wound.
With 2 patients on his hands, Jack decides Simon is in the most stable condition for the ambulance crew to take over.
I've not taken his trousers off. It looks like there may be some bowel there. There's like a nice vein through part of the flesh, so it could be quite fatty, but I'm not prepared to say it's not bowel.
Yeah, no, sir.
All right.
The other victim, Matthew, is still in the stairwell and in more urgent need of Jack's critical care.
I can travel with either. Probably this chest guy. Probably stick with him because he's going to be the sicker guy.
A bit longer, and if there's anything going to go wrong, it's going to be with him.
Yeah.
Okay.
I'm guarding these for their safekeeping. Please do not say anything. Stay there.
With tensions running high, police officers make a cordon to shield the paramedics from harm.
You guys have to get him on, and I'm going to start drawing you up on TXA. Stand by. Life-threatening.
Life-threatening, okay.
Potentially life-changing. Yeah, you get him gone, get him gone.
Get him onto the truck, yeah?
I'll meet you there. Yeah.
So the dog ambulance can take you down to the ambulance.
It's vital Matthew is kept as calm as possible. With 2 deep stab wounds, any rise in blood pressure will increase the speed of blood loss, and he could go into cardiac arrest. With a police dog escort as protection, Matthew is quickly evacuated to the safety of the ambulance.
Let him go now.
Yeah, go on, I know, yeah.
Try and get these doors. Yeah, I'm going to get them.
Sorry. 6-2, go ahead. Very disordered scene. Can you pull yourself forward, mate, with my help? Matty, give us a hand. Now push yourself as far back as you can and get yourself sat up nice and high for me. Get your legs planted in, you've got good movement. You're doing really well. I know this is a really distressing time, but we're going to get you through it, all right?
Once on board, Jack gives Matthew a vital injection of tranexamic acid to try and stem the blood loss before updating the trauma desk.
I can't breathe.
So I have got a 41-year-old male. We've got 2 wounds. Okay, 1 non-sucking chest wound to the right anterior and 1 wound to the right lower quadrant.
They will alert the hospital to expect 2 critically injured patients who will need urgent surgery.
He's had TXA oxygen applied. The other patient is on the other vehicle. He has an abdominal wound, potentially a spat of small bowel visible. We are leaving scene now for the QE, ETA approximately 6 minutes.
While travelling on blue light, Jack closely monitors critically ill Matthew.
Is that pain a bit better? Yeah? Feel a bit easier? Good. You able to take a deep breath in for me? And out. Sore on that side? It's all right, I know, I just need this chest heel to stick a bit. Otherwise it's not doing a huge amount. I don't think you damage your heart, I think it's your lung, essentially, or the space where your lung should be, okay? When the call came in to say we had 2 patients, potentially both unconscious, I'm thinking traumatic cardiac arrest, I'm going to have to really prioritise who's going to get my help first. Yeah, just twice. The trick with these patients is get going while the going's good and don't waste time. We're not going to fix their problems on scene. If they arrest on scene, we're in a whole world of trouble.
30 minutes after the emergency call was made, both victims are handed over to the major trauma team at the Queen Elizabeth Hospital, Birmingham.
Either of those wounds could potentially kill someone. The gentleman that I was with, he had air in his chest that was taking up space that lungs should have been taking up, so compromising his ventilation. The other gentleman, if he's nicked his bowel, that can be really quite complicated. Both are going to be at least life-changing and going to require significant recovery.